everyone, and welcome back to the Health Equity Chats podcast. I hope you've been able to view our previous episode discussing heart health and nutrition with some awesome guest stars. So for today, we will be highlighting one of the excellent community-based organizations in Las Vegas, which is the Just One Project. I'm Grissel, a health educator here at the Southern Nevada Health District, and I will let our guest star introduce herself.
Hi, I'm Kate Minson. I am the Food for All Program Director at the Just One Project.
Oh, thank you so much for your intro, Kate, and really to jump in and kind of discuss the awesome work that the Just One Project does. So, Kate, can you please tell us about your organization and who created your organization?
Yeah, so we were founded in 2014 by Brooke Neubauer, who is currently still our CEO. And it was a grassroots organization. And she started the organization with 4 people and grew it to what it is today.
Oh, man, that's excellent. So really a lot of growth going on there, huh?
Yes, we're up to almost 60 employees now.
Oh, my gosh, congratulations. That's a really big success. So, Kate, can you tell us about the mission and values of the Just One Project?
Yeah, so the Just One Project is a community-based organization that we strive to create a community, like a program for everybody, that where everybody is welcome. And we have programs that we try to support every member of the community. We really try to serve with dignity and respect, and not exclude anybody for any reason.
Awesome. Those are some really great values that your program has. And then, Kate, would you be able to tell me a little bit about the gold standard that I was able to see during research with the Just Run project?
Yeah, so our gold standard is just the level of service that we provide. So when I try to explain it, I kind of explain it as how you would want to serve your family or how you would want to be served. So we always make sure that we have the freshest produce available in our pantries. We don't put food on the floor. Our markets, when you come into our no-cost markets, they look like a little grocery store. It's not just wire racking that you see at a typical pantry. Not that there's anything wrong with wire racking to hold the food, but there's just something different that you go in and it looks like you're shopping in a store versus shopping in a small little room with some cans that got thrown together.
Oh, that's excellent too. It really gives the different folks that come into the Just One Project a lot of options to be able to kind of look around and see like what they would be able to take home. So, Kate, what other services does your organization provide? I know you touched on the food pantry, but what else do they do?
Yeah, so we have lots of food programs. We are a food-based organization. We have a wide range of programs that serve pretty much the gamut. So we offer Meals on Wheels to homebound seniors. We offer a program called CSFP, but gently called, but also referred to as the Senior Nutrition and Wellness Program.
Oh, excellent.
That's for seniors 60 and better that have to meet a certain guideline. We have our no-cost community market that we discussed. Farmers markets that we offer that are no cost as well. We have a food rescue program that runs, and we rescue food from different casinos and different organizations. So many programs. And we also have our Groceries on the Go bus. Oh my goodness, there's one more that I'm missing. Oh, we do our Pop-Up and Gives one Saturday a month. That is a mobile distribution outside of our pantries that we offer at our physical location.
Oh, awesome. So it really sounds like folks, they have a lot of options to be able to really get this nutritious food. And then, Kate, would you be able to tell us a little about food insecurity, specifically in Las Vegas?
Yeah, for sure. I want to get my information right. So in Southern Nevada, there's more than 270,000 Southern Nevadans who are food insecure, and that includes 1 in 6 children. This is a figure that Three Square has been able to research and find. And food insecurity itself is it means that an individual just does not have access to food. So they're unable to either purchase the food, or unable to get in a vehicle and get to the food, whether they're homebound or they just don't have a vehicle. They have to take the bus. So it's having lack of access to nutritious foods.
Thank you so much, Case. And I really like how you were able to highlight really that transportation aspect of being able to access food. You know, we get to almost 115 degrees for a good portion of the year. And for folks to be able to really kind of wait for the bus, sometimes it gets hard for folks. So I think that's really awesome that you were able to kind of highlight that aspect as well. So, Kate, tell me a little bit more about how folks can access the different food pantries. I know you were discussing Meals on Wheels, but what about your physical location?
Yeah. So we have a couple different options. We have a drive-through style pantry that people can register for. We have a choice pantry, and we also have the farmer's market that I mentioned. Those are all done by appointment, just so we're able to know how many people we're serving, and we can have the appropriate amount of food to prepare. Not to say that we can't have an emergency here and there, but we like to just know ahead of time. So anyone can schedule an appointment there's a form on our website or calling us, and our other the Pop Up and Give that I mentioned, that program is through first come first serve on the second Saturday of the month. So people can just line up and they arrive, and we will serve until the food is gone.
Ooh, excellent. And then for that pop-up location, do you guys cycle different locations, or is it one main area?
So there's 10 different locations at 10 different schools. So they're all around the valley. They're listed on our website, because if I list them off, I know I'll get them wrong. But they're centrally located so that they kind of hit all the points of the valley.
Oh, excellent. And again, folks, that is the official Just One Project website, which can be accessed directly by putting that into Google. So, Kate, would you be able to tell me about maybe any requirements that folks might have to meet to be able to access these food pantries?
Yes. So we do ask to have that everyone is a resident of Nevada. But other than that, most programs, food-based programs, we don't have a lot of guidelines. Meals on Wheels, that is a homebound program. Clients need to be homebound and unable to prepare their own meals. So we will deliver the meals to them. And then for the Senior Nutrition and Wellness Program, that as well has an income guideline set forth by the government, not by myself or our organization, but that also it's for individuals who are 60 or better and have a specific income guideline that they meet.
Awesome. And then all these contact phone numbers would also be found on the website, correct?
Yes, correct. It's our main line, which is listed there.
Awesome. Thank you so much. And then when I was doing some research into your program, I came across the term they use food as medicine. Would you be able to maybe kind of talk a little about the definition of that term and how that applies to the Just One project?
Yeah. So food as medicine is a newer term that's come out in the last couple of years, and it's been applied to Medicaid and actually utilizing funds from Medicaid to purchase food as a prescription plan. We are definitely using it as just trying to offer the freshest produce and freshest food to our clients. So we call our farmers markets food as medicine farmers markets, because we are offering only fresh produce and protein, bread, and from time to time a few other fun things. But food as medicine is generally referring to the ability to use food to help lower the occurrences of chronic disease.
Thank you so much, Kate. And then would you be able to discuss just how important food is to just overall health? Yeah.
I mean, I don't know about you, but if I miss my lunch, I'm definitely not functioning
you
properly.
Get a little hangry.
Yeah. So if you're coming in as someone who's been struggling to access food, typically you see people who are struggling with chronic disease, because most chronic disease are linked to food consumption of some sort or another. Diabetes, obesity, heart disease. And it kind of goes back to that with food insecurity, a lot of food insecure people, there's a lot of statistics out there. I won't throw statistics around, but there's been a lot of research done around it, and a big percentage of people who struggle with food security are struggling with chronic disease as well. And so we use the term food security a lot, but we forget something that's come up in the last couple of years has been the term nutrition security, and really referring to the fact that like if you don't have access to nutritious food, you may have access to a McDonald's, and that's the closest food outlet. But is that going to be providing healthful food to your family every day? No, probably not the best thing. We've all seen Super Size Me. Oh, yeah. So it's really just not having access to those healthy foods. It really impacts people, and the research is there, and it affects you. Like I can't imagine not being able to feed myself or my family every day.
Thank you so much, Kate. I love how you highlighted how food, it really influences those chronic conditions such as diabetes, obesity, and heart conditions as well. So it's really important to be able to find kind of these local sources of nutritious food. So awesome for the Just One Project to be able to provide that for folks. So Kate, would you be able to tell us about the Food Rescue Alliance?
Yes. So the Food Rescue Alliance is a partnership with the Venetian. We go to the Venetian every month, several times a month, during their conventions, during and after their conventions and conferences, and collect the unused products that they have. It ranges. It could be produce, bread, pastries, full prepared meals. We take those foods, bring them back to our location hot, break them down into smaller portions that are more manageable for a family to take home, cool it and freeze it, and distribute it all out into the community within 48 hours. The distribution is through our pantries, so our drive-through, and in our choice markets, and we also work with about 20 different community partners to distribute that food.
Oh my gosh, what an awesome way to be able to reduce food waste, especially, from casinos, since, hey, we're in Las Vegas, so casinos is kind of the name of the game there.
Yep.
So it's a really great program that you guys are able to offer. And then, Kate, what other special programs does the Just One Project offer, maybe apart from the traditional stuff we associate, such as like food programs?
Yeah. Well, we have, traditional food programs That's
the main game.
We have our one program, I'm going to mention one more food program, only because it's special. So it's our Groceries on the Go bus, which is actually a low-cost grocery store that goes into food deserts and low-income, low-access areas of the valley and into our rural communities. It accepts SNAP benefits. We sell fresh produce. We have everything in the bus that you could buy at the grocery store. And
excellent.
Yes, and we are really trying to provide low cost, so like nothing costs more than what it does at the grocery store. We try to aim for less. Sometimes things like eggs, we really can't get them anywhere right now. Everyone knows the eggs are $8 a dozen right now. But we do try to offer the best price available, and we price match. We do all the things to make sure that everyone's getting the best price. And we serve a lot of senior housing, places that people just don't have access. We're discussing that access, like they're not able to get out of their homes. They're able to just come down to the parking lot, shop in our bus, and they get their groceries. And people have really expressed a lot of gratitude for that, especially in those rural areas that have maybe a gas station, and then 45 minutes to an hour is the closest grocery store. Been very successful. That program is one of my favorites, and if you see the big pink bus, you can't miss it. You gotta wave and say hi. Yeah, it's got waving produce on the side. Along with that, we also have social service programs that we offer. In our community market, we have case management, and they work with our clients directly to help bridge the gap of whatever the need is of the client. So they work directly with our clients to identify if they need to sign up for SNAP benefits, help them fill out that application, finding what other public assistance programs might be available for them. If they need childcare, trying to, find a childcare facility that they'll be able to register for and maybe is on an income-based guideline. The case management really is on a one-on-one basis and trying to identify and build that bridge to help that client not rely on the food of the free food services. Because while food is the welcome mat, we really don't want it to be the Band-Aid on the problem, right? Like it's just free food services constantly being offered doesn't fix a problem. We also have several different housing programs, including homeless prevention, rapid rehousing, and shared housing.
Oh, excellent, excellent. So I know when I was doing my research initially for this podcast, I was coming across the different housing programs that you guys have. And that's really excellent, too, that you guys are able to offer that for the community, especially since, there's a really big need for folks, especially right now when stuff is really expensive. And then, Kate, if folks might want to be a little bit more involved within your project, how might they be able to volunteer?
Yeah, so we love our volunteers. We are a volunteer-based organization through and through. We just hit 20,000 volunteers in our volunteer database, which was super exciting for us. Yeah, and so if someone was interested in volunteering with us, they would just visit our website. They can always just visit our physical location too. But on our website, it has the little application, not very much information, just like your name and email address. And then you can access the schedule for all the different opportunities. We have packing in our warehouse to pack the bags and boxes that we distribute, the actual pantry line that goes through to place the food in the bags or in the cars, and for those pop-ups on Saturday that I talked about. And then also we have home delivered meals that we deliver, and our volunteers can do that as well. So
excellent.
It's a lot of fun.
That's like a really great opportunity for folks who, might want to get a little bit more involved within this community-based organization. And then, Kate, I can't remember if you mentioned, but can you tell us the address of where your main facility is at?
Yes, we're at 1401 North Decatur. We have several suites. So Suite 32 will be the best suite to visit. It has a big pink heart. You can't miss it. And that's where our market is. We're open from 8 a.m. to 2 p.m. For people to kind of walk through the door.
Awesome. So much. Thank you so much, Kate, for being able to give us the address for that. And then when I was doing some of the research, I saw that the Just One Project had some different workshops that you were able to offer.
Yes.
Maybe you can speak of on the previous workshops and maybe some upcoming ones as well.
Yeah, so we have actually just started implementing the workshops. So we have a financial literacy class. This one is first Tuesday of the month. And these are held, so our preface, the workshops are held in Suite 32. Or sorry, Suite 30. 32 is where you would visit. Suite 30 is where all our classes are. Like I said, we kind of have a scattering of suites in our strip mall. And the financial literacy class is for adults and for youth. We also have an employment readiness class and soft skills. So for interviewing skills and just general job readiness. That's on the second Tuesday of the month. And then we have confidence building, which is offered by our community partner, Dress for Success. And that is for women or anyone who's identifying as a woman and is 16 years or older. And that's really to help develop goals and plan for long-term success.
Thank you so much again. And again, this is in Building 30.
30, yes,
This is
at 1401 North Decatur.
Awesome. Thank you so much, Kate. So we're just about wrapping up the podcast for today. So would you be able to kind of give us a fun fact about the Just One Project?
Yeah. So I know I mentioned Brooke, our founder and CEO. So this is the fun fact that I always share on my tours. So when she first started doing what she did that sprung the Just One Project. So she was actually with a mom group, and she had actually never volunteered a day in her life, and she started handing out food in the parking lots of schools. So our pop-ups are homage to that, and she didn't realize that there was a need, like there is in the Valley, and she started to hand out this food and saw the people showing up every week, and that was what started the seed to grow what we are today.
Oh, excellent. That's such a really awesome origin story to your really great program. Okay, great. One more question for you.
Yeah.
So what do you want the listeners to take away from today's episode?
Yeah. I really feel that food, and I think that everybody should have this mindset around it. Food is not a privilege. It's something that everybody has the right to have and should have access to, especially healthy food. And I think in our society right now, it's seen as a privileged thing to be able to access healthful food. And I think the conversation's changing a little bit, but things like this are really great to be able to discuss that and bring it to the table and show that, you know, people need food. It's a requirement.
Yeah,
not an option.
Hey, thank you so much, Kate, for being able to kind of explain the really inner workings of the Just One project. So in today's podcast, we were able to cover the awesome work that the organization does. Again, this information can be accessed on their official website, which can be found by looking up the Just One project on your Google browser or Safari browser. So thank you guys for listening today, and stay tuned for our next episode. As always, stay healthy, Clark County.